Your ankles are swollen again. Maybe they've been swollen for weeks or months, or honestly, you've lost count of how long this has been going on. You press your finger into the skin just above your ankle bone, and when you lift it, the dent stays there for a few seconds before slowly filling back in. You've been told it's your heart, or your kidneys, or just getting older. You've had the tests, maybe everything came back normal, and yet there they are, puffy, heavy, tight by the end of the day, and nobody gave you a real answer. I want to give you that answer today, because in most women over 60 who come to me with this exact complaint, normal heart function, normal kidney labs, no obvious cause, the real issue is sitting in a system that almost nobody talks about. It's not your cardiovascular system, it's your lymphatic system, and the difference between those two things matters enormously because the solution is completely different. Hi, I'm Dr. Allah. If you just felt like I was describing your mornings or your evenings, or honestly both, please stay with me. Because what I'm going to walk you through today is something I wish every woman over 60 heard from her doctor at a regular checkup. Most don't. I'm going to change that right now. Let's start at the very beginning because I think the lymphatic system is one of the most underappreciated systems in the entire human body, and most people have almost no idea what it actually does. You know, your heart pumps blood, you know your lungs bring in oxygen, but your lymphatic system? It quietly does one of the most important jobs of all, and it does it without a pump, without a heartbeat, and almost entirely without your awareness until something goes wrong. Here is what it does. Every single day, your blood delivers nutrients and oxygen to your tissues through tiny capillaries. But as it does that, a certain amount of fluid leaks out into the spaces between your cells. That fluid, called interstitial fluid, carries with it waste products, proteins, immune cells, and cellular debris. Your body needs to collect that fluid and return it back into circulation. That is the lymphatic system's job. It is your body's drainage network, a vast, silent web of vessels, nodes, and channels that runs alongside your blood vessels and quietly collects this excess fluid, filters it, and returns it to your bloodstream. When that system works well, you never think about it. When it slows down, and after 60, it very commonly does, the fluid that should be moving out of your tissues starts to accumulate. And where does it accumulate first? In the lowest points of your body, your ankles, your feet, sometimes your calves. Now here is where I want to slow down because this is the part that changes everything for most of my patients. There is a very important difference between swelling caused by your heart and swelling caused by your lymphatic system, and knowing that difference is the first step toward actually fixing it. When your heart is struggling, when it is not pumping efficiently enough to keep fluid from backing up into your tissues, the swelling it causes tends to be consistent. It is there in the morning when you wake up. It gets worse as the day goes on. It is often accompanied by shortness of breath, by fatigue that goes beyond just feeling tired, sometimes by a sensation of heaviness in your chest. And critically, it usually shows up in both legs equally, and it tends to respond to medications that reduce fluid retention. If your doctor has checked your heart and your results were normal, that pattern probably does not describe you. Lymphatic swelling looks and feels different. It tends to be worse at the end of the day and better, sometimes almost gone in the morning after you have been lying down. It often feels more like tightness or fullness than true pain. The skin over the swollen area may feel slightly firm or doughy. You may notice that your shoes fit fine in the morning and feel impossibly tight by 3 in the afternoon. You may have one ankle that swells more than the other, and when you press that skin and leave a dent, what doctors call pitting edema, and it fills back slowly, that is a classic sign that fluid is pooling in the tissue, not moving through it the way it should. Now, why does this happen more after 60? I get asked this question constantly, and the honest answer is that it is a combination of several things working against you at once. First, the lymphatic vessels themselves lose some of their tone and elasticity with age, just like blood vessels do. They become slightly less efficient at propelling fluid forward. Second, the muscle contractions that help push lymph through its vessels depend on you moving. And as we get older, many of us move less, whether because of joint pain, fatigue, or simply a more sedentary lifestyle. Third, hormonal changes after menopause affect fluid regulation in ways that are still being studied, but the clinical reality is clear. Women after menopause report this kind of swelling far more frequently than younger women. Fourth, prolonged sitting at a desk, in a car, in front of a television is one of the single biggest contributors to sluggish lymphatic flow in the lower legs. Gravity pulls the fluid down, and without movement, there is nothing to push it back up. And here is something I find most people are genuinely surprised to learn. The lymphatic system has no heart. Your cardiovascular system has a powerful pump, your heart beating roughly 100,000 times a day to keep blood moving. Your lymphatic system has nothing like that. It relies entirely on 3 things to move fluid: the rhythmic contraction of smooth muscle in the lymphatic vessel walls, the movement of surrounding skeletal muscles during physical activity, and the mechanical pressure changes that happen in your chest when you breathe deeply. That is it, which means that when you sit still for hours, breathe shallowly, and your muscles are not Moving your lymphatic system essentially stalls. The fluid it is supposed to be draining just sits there in your ankles. So now you understand why this is happening, but understanding why is only half of what I want to give you today. The other half, the part that I think is going to genuinely change your daily life, is what you can actually do about it. And I want to start with the most important thing I tell every patient who comes to me with this exact problem. The solution is not a pill. It is not a compression stocking, though those can help. It is not another test or another specialist referral. The solution is movement, specific, intentional, targeted movement, and you can do it in 5 minutes in your own home, starting today. Before I walk you through the exact habit I recommend, I want to make something very clear. If your swelling is new, if it came on suddenly, if it is only in one leg, if it is red or warm or painful to the touch, if you are having any shortness of breath or chest discomfort, please see your doctor right away. Those symptoms need to be evaluated. What I am describing today is for women who have had this checked, who have ruled out the serious causes, and who are left with chronic, recurring ankle swelling that nobody has given them a satisfying answer for. That is an enormous group of women, and they deserve real guidance. Now, the 5-minute lymphatic drainage habit, I call it a habit deliberately because that is exactly what it needs to become. Not something you do once when your ankles are at their worst. Something you do every single day, ideally twice a day, once in the morning before you get out of bed, and once in the evening before you go. 2. Sleep. Consistency is everything with the lymphatic system. One good session will give you temporary relief. Daily practice will begin to genuinely change how your lymphatic vessels function over time. Here is what the routine looks like. You are lying flat on your back in bed is perfectly fine. You do not need a yoga mat, you do not need equipment, you do not need to be particularly flexible. The first thing you do is elevate your legs. You can prop them against the headboard, rest them up the wall, or simply place 2 pillows. 45 minutes to an ankle. Your lymphatic vessels will thank you. Now let us talk about compression garments, because I know many of you have already been told to wear compression stockings, and I want to give you a nuanced, honest perspective on them. Compression stockings can be genuinely helpful for lymphatic swelling, but only if they are the right compression level, worn correctly, and put on at the right time. The most important thing to understand is this. Compression stockings should be put on in the morning, before you get out of bed, before gravity has had a chance to pull fluid into your ankles. If you wait until your ankles are already swollen and then try to squeeze a compression stocking on over them, you are fighting a losing battle, and the garment will be far less effective. Put them on while your legs are still at rest and the fluid has not yet pooled. That is when they work best. The compression level matters too. For most women with mild to moderate lymphatic swelling, a compression level of 15 to 20 or 20 to 30 millimeters of mercury is appropriate. Anything higher than that should really be prescribed and fitted by a healthcare provider, because too much compression can actually impair circulation, rather than help it. If you have been wearing compression stockings and they do not seem to be helping much, it is worth asking whether the compression level is right for you and whether you are putting them on at the optimal time. I also want to spend a moment on hydration, because this is one of the most counterintuitive things I tell my patients, and it consistently surprises them. When your ankles are swollen, the instinct is to drink less water because it feels like you already causes your body to retain water. That is simply how it works. When sodium levels in your blood rise, your body holds onto water to dilute it back to a safe concentration. That retained water has to go somewhere, and in the lower extremities, it tends to settle in the tissues around your ankles and feet. This does not mean you need to eliminate salt from your life entirely. Sodium is an essential mineral and your body genuinely needs it, but it does mean that being mindful of your sodium intake can have a very real, very noticeable impact on how much your ankles swell. The sources of sodium that catch most people off guard are not the ones they expect. It is rarely the salt shaker on your table. The biggest sources of hidden sodium in a typical diet are processed and packaged foods, canned soups, deli meats, frozen meals, condiments, bread, cheese, and restaurant food. A single bowl of canned soup can contain over 1,000 milligrams of sodium. A restaurant meal can easily contain 2,000 to 3,000 milligrams, which is already at or above the recommended daily limit for most adults. If you have been struggling with ankle swelling and your diet includes a significant amount of processed food, reducing your sodium intake is one of the most practical, immediate changes you can make. You may begin to notice a difference within just a few days. On the subject of nutrition, I also want to mention magnesium, a mineral that plays a quiet but important role in fluid regulation, and that a significant percentage of women over 60 are not getting enough of magnesium. One more lifestyle factor that I think deserves honest attention is alcohol. Alcohol causes vasodilation, the same widening of blood vessels I just described with heat, and it also temporarily impairs kidney function, which means your body retains more fluid after drinking. If you notice that your ankles are consistently worse the day after you have had a glass or two of wine, that is not a coincidence. It is a direct physiological effect. I am not telling you that you can never enjoy a drink, but if ankle swelling is something that significantly affects your quality of life, it is worth being honest with yourself about whether your alcohol intake is contributing to it. Now, I want to talk about something that goes a little deeper because some of you watching this may be doing everything right, and your ankles are still swelling. You are moving regularly, you are watching your sodium, you are doing the 5-minute routine, and still the swelling persists. If that is you, I want you to hear this. Clearly, that is not a failure on your part. It may mean that there is an underlying factor contributing to your lymphatic sluggishness that needs to be identified and addressed. One of the most common underlying contributors I see in women over 60 is hypothyroidism and underactive thyroid. The thyroid gland regulates your metabolism, and when it is underperforming, the effects ripple through almost every system in your body. One of those effects is a specific type of fluid retention called myxedema, where a particular kind of protein-rich fluid accumulates in the tissues, especially in the lower legs and ankles, and sometimes around the eye. Woman over 60 to be aware of because you may be taking one of them and not realize it is part of the problem. Calcium channel blockers, which are commonly prescribed for high blood pressure and heart rhythm issues, are among the most frequent medication-related causes of ankle swelling. Amlodipine is one of the most prescribed of these, and ankle edema is one of its most well-documented side effects. Other medications that commonly contribute include certain antidepressants, some diabetes medications, hormone therapies, and non-steroidal anti-inflammatory drugs used regularly. I am absolutely not telling you to stop any medication without talking to your doctor first, but I am telling you that if your ankle swelling began or worsened around the time you started a new medication, that connection is worth bringing up at your next appointment. There may be an alternative medication that works just as well for your condition without the swelling side effect. I also want to spend a few minutes on something that is deeply practical and that I genuinely believe can make a meaningful difference in your long-term lymphatic health, and that is regular walking. Not intense exercise, not running, not anything that requires a gym membership or special equipment, just walking, 30 minutes of. Walking at a comfortable pace most days of the week is one of the most powerful things you can do for your lymphatic system. Here is why. Walking is a full lower body rhythmic movement. Every step you take contracts your calf muscles, your thigh muscles, and your hip muscles. Every one of those contractions the impact on your joints. The hydrostatic pressure of the water also acts as a whole body compression garment, gently pressing on the tissues of your legs and supporting lymphatic flow. Many women who cannot comfortably walk for 30 minutes on land find that they can walk quite comfortably in a pool for that same duration. If you have access to a community pool or a therapy pool, I genuinely encourage you to try it. Rebounding, bouncing gently on a small trampoline, is another movement that has attracted a great deal of attention in the lymphatic health community, and I want to give you an honest assessment of it. The claim is that the rhythmic up and down motion of rebounding creates rapid, repeated changes in gravitational force that powerfully stimulate lymphatic flow. The evidence behind this specific claim is not as robust as the enthusiasts would have you believe, but the underlying principle is sound. Any rhythmic, whole-body movement that activates muscle contractions throughout the lower body and core will support lymphatic drainage. If you enjoy rebounding and your balance and joint health allow for it safely, it is a reasonable addition to your movement routine, but it is not magic and it is not necessary. Walking, done consistently, will accomplish the same goal.